Health officials say that they have confirmed the first ever case of bubonic plague in a Michigan resident. This marks the 14th case of the plague reported in the United States since the beginning of April. 4 of those affected have died. Dr. Amar Safdar is an infectious disease specialist from New York University's Langone Medical Center, and he joins us now with more.
Hello.
Doctor, thanks for joining us.
My pleasure.
You hear bubonic plague, you don't think of something that's happening today.
Sure.
How did this happen?
So, started around 1900s when, there is no bacteria in the New World, in the Americas. So it was brought on with infected rats on the steamships into the West Coast, various different ports on the West Coast of US. And most believe it came from Asia. And then there were outbreaks after outbreaks. So the last outbreak, urban outbreak in US was in LA. Started in 1924, lasted until the following year, 1925. And since then, the bacteria has found a foothold, and it's endemic now in the western US, mostly in the rodents, rodents in the wild, chipmunks and what have you. How do one get exposed to it? Usually the fleas from the rodents and the bite from those fleas is how the bacteria gets into someone's system.
Is that pretty much the only way that it can spread? It can't spread like through human contact?
Great. That's a great question. The 4 cases this summer, a few months ago, that were reported by CDC were from a dog that got sick and died. The 2 folks in the veterinarian clinic, the person who was the owner of the dog, and another person who was friend of this individual patient who developed plague were exposed. The 2 people in the veterinarian clinic were exposed from the dog, but his friend has never seen the dog or met the dog. So that was potentially a transmission from this individual whose dog died of what seems like plague. And he developed an unusual form of plague, which hasn't been seen in US since 1924, which is called pneumonic plague. So it is a pneumonic
That's very
plague.
concerning.
Well, it's the pneumonic plague that actually can be transmitted. But the bubonic plague, which is a more common form, 80% or so, does not get transmitted from person to person. There is a lot of concern because it's an older disease, and the Black Plague that people have read about in their history books sort of stays in mind, and it invokes all sorts of fear.
Absolutely. You have these images in your head.
Sure.
That you learned about, in history class.
Certainly. So back in the old days, the death associated with plague was 60% to up to 90%. So really a very serious infection. The wonderful thing now is there are several antibiotics that work beautifully against this infection. So now mortality is usually less than and close to about 15%. So it has come a huge step down from 90 or 60% down to approaching 15%. The important thing is, how does one prevent getting exposed to it? Well, do not feed and stay away with rodents, even though they look very cute. But
they're not very cute in New York.
Do not get exposed to them, and certainly do not feed them, and do not handle if one come across during hikes and what have you, or camping, a dead or sick appearing rodent. The other thing is, well, it seems to be difficult to diagnose it because unless you have your suspicion high enough, it could mimic several other infections. Well, except when it presents with huge tender lymph nodes, which are really grotesque, large lymph nodes. That's why bubonic plague. Those are difficult to miss. And then it should be in any physician's differential when someone presents, especially in the western US.
All right. Well, Olive, unfortunately, we've got to get going because of time. But the bottom line here is, even if you're an animal lover, just stay away from those rodents.
And one other thing, there are only 14 cases so far this year.
Yes.
There were 17 cases reported in 2006. Last year, there were 10 cases. And the year before, only 4. So it does go up and down. So I don't think there is
Maybe
any reason
staying
to
on the
get alarmed
trend.
that
Okay.
suddenly we have doubling of cases, because it does go up and down, and there are several reasons why this happens.
All right. No need to panic.
Do not panic.
All right, Dr. Amar Safdar, thank you for your expertise.
My pleasure. Thank you.